Bismillahirrahmanirrahim. My name is Shahzaib Akram and registration number is 64 and I am student of BS MLT 8th semester, Kohat University of Science and Technology. And today is my presentation topic is Capillary Specimen Collection. Outline. Outline of my presentations are capillary specimen collection, indication for capillary puncture, requirements and procedure. Capillary specimen collection. Capillary specimen collection, also called dermal or skin puncture, a drop of blood for testing can be obtained by puncturing the capillary bed of the skin with the lancet or other sharp device. Useful in pediatrics where removal of larger quantities of blood can have serious consequences. Collection sites include the finger of adult and children over the age of 2, heels of fans. Indication for capillary puncture. For adult और older children के लिए कौन सी indications हैं? There is no accessible veins. Available veins are fragile or must be saved for other procedures such as chemotherapy. The patient has thrombotic or clot forming tendencies. Blood is to be obtained for short procedure such as glucose monitoring. Indication for infants and very young children. Infants have a small blood volume. Removing quantities of blood typical of vein punctures or arterial punctures can lead to anemia or threaten life if over 10% of blood volume is removed. Vein puncture is difficult and can damage veins and surrounding tissues. They can be injured by the returning method used during vein puncture. Capillary blood is the preferred specimen for some tests such as newborn screening test. Requirements: gloves, antiseptic prep pad, safety finger puncture lancet, microcollection tubes, gauze pads, sharp container, permanent ink pen, bandage, warming device. Alcohol gauze bandages. CLSI recommended using 70% isopropyl alcohol to clean capillary puncture sites. Gauze or gauze type pads are used to wipe away the fast blood drop to eliminate alcohol residue and excess tissue fluid and to hold site pressure after specimen collection. Bandaging materials are used to cover the sites after the collection but are not to be used on infants under the age 2 due to the danger of aspiration. Lancets are sterilized disposable used for capillary puncture. They come in a range of length and depth. Select according to patient age, collection site, and volume of blood required for the test. Their blades and points must to prevent sharp injuries. Warming devices. Warming the site increase blood flow up to 7 times and is especially important when performing heel sticks. A towel or diaper dampened with warm water can be used. Water temperature must not exceed 42 degrees or it could scald the patient. Micro collection tubes micro tubes भी कहा जाता है are special small plastic tubes coated with heparin for collecting directly from capillary puncture are planned to be used when forming with blood from an additive tubes. Procedure: reviewing and assessment test request. Identify and prepare patient. Prepare equipment, sanitization hands and put on the gloves. Select the puncture incision site. Warm the site if applicable. Clean and air dry site. Puncture the site and discard lancet device. Wipe away the first blood drop to prevent contamination of the specimen with excess tissue fluid and residual alcohol. Fill and mix tubes container in the order of draw. Place the gauze and apply pressure to stop the bleeding. Label specimen and observe special handling instructions. Check the site and apply bandage. Dispose of used materials. Thank patient, remove gloves and sanitize hand. Transport specimen to the lab. Heel puncture. In this heel puncture, select a site on the medial or lateral plantar surface of the heel that is warm, normal color and free of cuts, bruises, infections, rashes, swelling or previous puncture. Heel puncture sites in infants. This is the summary of our whole lecture or presentation, that how to collect the specimen, capillary specimen. Thank you.